Hi, and welcome to Queensland X-Ray. You're probably watching this video as you've been referred to us for an interventional procedure. Unlike some of our other services, interventional work can be quite complicated and will require one of our specially trained radiologist doctors to attend, as it involves a minimally invasive image-guided diagnosis and treatment, often using the injection of drugs or the removal of tissue. In this case, you'll be having a PRP or platelet-rich plasma injection. Having a PRP injection is actually pretty interesting, as your blood contains many properties that promote healing. When we inject components of your blood, namely platelets, into an area that is causing you pain, it can actually help relieve the discomfort. In most instances, we do this for people who suffer from tennis or golfer's elbow, plantar fasciitis, hamstring tears, jumper's knee or patella tendinosis, Achilles tendinopathy, and calf muscle tears. Prior to having this done, you'll need to have been referred by your doctor to have initial imaging completed. This will help us determine the exact location of your pain. Our radiologist will then review these images and will decide if a PRP injection is appropriate. As this procedure involves the removal of some blood, it is important to let us know if you are on any anticoagulant or blood-thinning medication at time of booking. You will also need to be off any anti-inflammatory medication 1 week before and after your procedure. When you arrive for your procedure, one of our friendly team members will ask you to complete a consent form to help us understand your medical history, what medications you're on, and any allergies you may have. This will help us ensure that nothing is done that might cause you any harm, so it's really important you provide us with as much information as possible at this early stage. We'll then ask you to change into a gown, and you'll come through to one of our special treatment rooms. One of our radiographers will draw some blood and take it into a room, where it will be spun around in a machine called a centrifuge, which spins thousands of times a minute. This will take around 5 minutes. Once done, your blood will have separated from being just fluid to being red blood cells, white blood cells, and platelets. These platelets are what will be used to inject back into your body. We'll now clean the site with antiseptic before administering a local anaesthetic to numb the area. The radiologist will then position the needle under the guidance of imaging technology to ensure it's in the best possible position. During this time, you may feel a little discomfort, but don't worry, we'll do our very best to keep you comfortable. You'll now be able to get changed and head back to the waiting room to chat to our friendly staff about your account. We also suggest you bring a friend along to drive you home after the appointment. If no one is free to help you with this, don't worry, we'll help you organise a taxi. After the procedure, you'll probably feel a little bit of discomfort in the area for a few days. During these days, and possibly the week, it's important you continue your rehabilitation program as suggested by your referrer or physiotherapist. After about 4 weeks, your pain should have decreased. If not, we suggest you return to your referring doctor to chat about other options, including the possibility of a repeat injection. This one might sound a little scarier than it actually is, but we promise you're in good hands when you come to Queensland X-Ray. Thanks for watching. We look forward to meeting you at one of our practices. For further information, please visit our website, queenslandxray.com.au.